Welcome to the Active Doctors Online webinar, Getting the Most Out of Your PHR Membership. I'd like to introduce today's presenters. We have Bernard Lee, who is the Executive Vice President at Active Doctors Online. He joined in 2010 and oversees the U.S. and Asia sales, account management, and marketing teams, as well as North American business development efforts. Bernard has over 20 years of broad management experience across multiple sectors, including business strategy, market development, and special purpose acquisitions. His responsibilities at Active Doctors also include directing strategic partnerships in the healthcare services and insurance segments. Our presenter, Dr. Howard Zahalsky, is the U.S. Medical Director at Active Doctors Online. Dr. Z is responsible for corporate medical strategy and improving the functionality and integration of ADO's products and services. He has extensive medical knowledge and background, which make him an ideal fit for ADO, where he continues to promote medical excellence in the industry. Dr. Zahalsky is also responsible for Active Doctors Online medical quality and review, and through his leadership, Medical Records Assistance Program has gained national recognition. Dr. Zahalsky earned his medical degree from Brown University and completed his residency at Johns Hopkins University. Welcome. What you'll learn today in our webinar is three main areas: why a personal health record is vital to your health and wellness, the practical benefits of a PHR and taking a proactive role in your health care. We'll look at some examples of this in everyday life, as well as interactive platform highlights. And this includes not only the personal health record portion, but also how to use medical records assistance and other services that are available to you. And with that, I'd like to hand it off to Bernard Lee.
Well, thank you for joining us this afternoon. My name is Bernard Lee. I'm the Executive Vice President for Active Doctors Online. Let's get right to it. Putting the personal in healthcare. Your medical records belong to you, yet few people actually ask for it or they've ever seen one. While most Americans rarely leave the supermarket, their department store, or even their bank without a receipt, we think very little of leaving a doctor's office without a record of the visit. We all have important health information such as blood types, immunizations, prescriptions, allergies, health conditions, and emergency contacts all over the place. They're either at home, they're in a doctor's office, or they're in some hospital record stashed away someplace in the safe. But this information, when consolidated into one central secure place, becomes something more valuable. It becomes your personal health record, or PHR. We believe that information is power. Now, a PHR enables control of your health information and gives you the power to make informed decisions. You can track important medical data, prescriptions, and care plans in a single place. But more importantly, you can save money by preventing duplicate or unnecessary tests. And it allows you to get the most out of every doctor's visit. With the Active Doctors Online PHR, we're offering the most advanced PHR and the first company to combine a second medical opinion service with membership. Now, in case you're not familiar with a PHR, it's a web-based set of tools that enables access and actually helps you to coordinate a lifetime of health information. You control your PHR as well as how appropriate portions are made available to others who may need it. And according to most industry experts, what you're seeing right now are the 7 attributes of an ideal PHR. And it's about control. It's your entire medical history. It's not just one provider, for example, which an EMR may provide. It's all of your providers. You have access to it 24 hours a day. Our EMR platform is secure and encrypted, and we actually incorporate military-level encryption. It's transparent and an audit trail. So when necessary, you can ask for and receive exactly who's seen it. And it is interoperable, meaning that our EMR is available to actually communicate with many of the EMR platforms that are out there. One of the things you'll hear a lot from Active Doctors Online is, save money, save time, and in some cases, a PHR can save your life. Active doctors, we're a lot more than just medical records, as we'll get into a little more today. As I mentioned, we're the first company to combine personal health records and online second medical opinions. Our solutions don't involve the red tape. There's not a lot of waiting. When you are a member of ADL, your information is at your fingertips. One of the things, and number four, we separate ourselves from a lot of companies to where we provide something called medical records assistance, which through a HIPAA release form will contact one of your physicians. We always suggest your primary care physician. We would gather the records on your behalf and then upload them into the platform for you. And this is, in the case is number 8, your plan is eligible on a pre-tax basis, so it's eligible for HRA, HSA, and also FSA accounts. The results, according to the California Healthcare Foundation, PHR users are more knowledgeable about their health. They take better care of themselves versus those who may or may not use paper health records. They have fewer duplicate tests and procedures. They have a better relationship with their physician. And in the case of a work environment, it helps reduce absenteeism and presenteeism. A few of the benefits, and I say a few because we're looking at a slide that has 7 or 8 of the benefits of your PHR, but I'll just kind of highlight a couple of them. One, when it comes to sharing your information with family members, caregivers, or doctors, much more easily and efficiently. You are in control of the PHR. So part of your membership allows you to provide access to whoever you choose, and obviously, your caregiver is, or your physician, are one of the first on your list. You can easily share that information, your test results, as in that access, with those individuals. It also allows you in cases in terms of, when you're traveling or students that are studying abroad for that unforeseen medical situation, you have access to that information, when you need it most. And speaking of, in case of emergency, we all remember Hurricane Katrina. And although it was a dramatic case of a natural disaster here, obviously in New Orleans and Louisiana, it was responsible for tens of thousands of lost medical records. Over 1 million people were displaced, and when a lot of these individuals relocated, the costs associated with reestablishing a medical history actually cost taxpayers hundreds of millions of dollars. Now, not to mention everything else that these individuals had to go through in the aftermath of this natural disaster. A more likely example might be in the event of an accident, a car accident, whatever it may be. Helping emergency responders or ER staff act quickly to provide critical care without waiting for records to arrive is one of the most valuable benefits of a PHR. So let's take let's look at how you and your coworkers can utilize a PHR. So let's take Tom. Tom has a family PHR membership. He's a lot like, I'm sure, a lot of folks, like all of us. He's married, 2 children. They're generally healthy, and they utilize the health tracker that's part of the plan for well visits, annual checkups. His wife may be watching some of her vitals, such as the cholesterol. In the case of his son, he has a basketball injury, so that PHR allowed for that urgent care technician to properly, take a look and understand what he may be allergic to. And overall, for the case of a family PHR membership, it provided an easy, secure access to information when the family needed the most. John, individual PHR membership, again, a lot like a lot of us, single guy, he's generally healthy. He used the health tracker for his annual checkups to go in and import that information into his PHR. He had a situation where he had a knee injury, and when he had the knee injury, he actually had an MRI. But for whatever reason, in the second follow-up treatment, he required a second one where that knee just was not doing well. So in the case of the second visit the physical therapist and maybe the physician, a MRI was suggested, but because John had access to his PHR and that previous MRI was uploaded into the system, he was able to share that information with the second physician, thus saving him money and also saving money for that employer where they're saved on healthcare costs of multiple imaging tests. And then lastly, we have Vanessa. Vanessa is a single mom. She's underinsured. And for her, that family PHR membership allowed her to save, again, valuable time and be able to share information, after an automobile accident. The emergency contacts were notified quickly. And in this case, the PHR provided information to the ER personnel that was potentially life-saving. I'm going to go ahead and introduce Dr. Howard Zahalsky to provide you more of a perspective from, obviously from his perspective on the value of a PHR membership. Dr. Zahalsky.
Hi, thanks for taking the time to be with us today, and thank you, Bernard. So I'm going to tell you from a doctor's perspective why a PHR, like Active Doctors Online's PHR, is so valuable. When a patient comes to the doctor's office, when a patient comes to my office, one of the hardest things is to gather all of the old information. You can save a lot of time in the doctor's office and end up waiting a lot less in the waiting room if you have all of your information readily available through a PHR. With Active Doctors Online's PHR, just a few buttons and boom, all of your old records are pulled up, all of your medicines, all of your allergies, even the ones you've forgotten about, they're all right there. Nothing gets missed. And as a result, I don't have to duplicate tests. I don't have to reorder MRIs like in the case of John, one of Bernard's test patients, because I can find it all there when I need it. Your health information and your records is useless to you if it's not there when you need it. This leads to better physician-patient interactions, and it helps you, the patient, be a more informed decision maker because you know what's going on in your chart. So let's talk about the ADO, Active Doctors Online solutions that are available to you. There are three parts of the Active Doctors Online solution system that we have. The first is the PHR that we've been talking about. Your family medical history, your past medical history, all of your records can be safely and securely stored in an easily accessible way. This is the main focus of the Active Doctors Online system. But with it comes a couple of other options as well. First, you can get an SMO, which stands for Second Medical Opinion. We have 1,500 specialists throughout the world in over 60 specialties that are ready to, for a small additional fee, provide you with a second medical opinion. So should you get a serious diagnosis or a serious medical condition, and you don't want just the buddy of your doctor who you went to, you want actually a top-notch specialist, you can use our second medical opinion process that I'll talk about in a few minutes to know that you are getting an unbiased, top-level second opinion. And finally, we have the e-consult option, which is being rolled out very soon, where you can, by using a webcam, a phone, and our secure platform, actually have a live time interaction with an actual physician to answer your questions on whatever may be bothering you at a time when you can't reach your regular physician, or if you don't even have a regular physician because you're out of town or have just moved. So let's take a look at Active Doctors Online's PHR. This is the dashboard, the page that you will come to when you load up. I'm not sure if you can read all of the text, but right on that dashboard, the home page, if you will, you have a quick summary for you and your doctor to look at. You can have your most recent tests, your basic medical history, your basic social history, and even your medication, so that just with a quick scan, all of the basic information that you need and that your doctor needs to potentially make immediate life and death decisions on you is readily available, even if you can't relay this yourself. One of the best functionality pieces of our PHR, as Bernard alluded to earlier, is our health tracker. here you can graph over time lots of medical information, your blood pressure, your cholesterol, your blood sugar if you happen to be a diabetic. This is great for positive reinforcement. You can see as you exercise more, your cholesterol and your blood sugar and your blood pressure all coming down. On the other hand, if you do need medicine, you can also see the response to that as well. Here on the next page, you can see our online labs, which isn't just labs. It's any data that you get. You can see there's a chest x-ray here, a CT of the brain. You can also look at laboratory tests, your cholesterol, your blood count, your kidney function tests, all quickly available with just a couple of clicks. So why should you be using our Active Doctors Online Second Medical Opinion? I told you earlier that we'd come back to this. With our Second Medical Opinion, you get a secure and protected second medical opinion from not just any doctor, but one of our high-quality specialists that I'll go into more in a few minutes. These specialists are your advocate. They are only looking out for you. They're not looking to do surgery on you. They're not looking to make more money by ordering expensive tests on you. They are, usually within 48 hours, able to provide to you a completely unbiased and secure second opinion for whatever problem that you might have. So how does the second medical opinion process work? Well, when you request the second medical opinion through our online portal, you're put in touch with a medical director, usually from the state that you are located in. That medical director then contacts not just one, but two specialists in the field of your question, and between the three of them, within 24 to 48 hours, we're usually able to get together and form an expert opinion to your question. The medical director will then come back to you, the patient, with the report, which the medical director has made sure is not just in medical ease. It will be in a form that you can understand, that you will be able to get a good answer to your question quickly. Now, as you can see by these arrows, this is a two-way street. It's not just you're going to give a question and you're going to be told the answer. If you have more questions, we are always there to help you. This is one of the best things about our second medical opinion, is that this is a two-way interactive street. As with everything with Active Doctors Online, we are always there to help you. So if you have any follow-up questions, you can get those questions answered by our medical director, who can go back to the specialist if needed. Now let's talk about these specialists. We are talking board-certified specialists who have a minimum of 5 years of experience and are practicing physicians. We're not providing specialists who are retired, haven't seen a patient in 5 years, or read a journal in 10. We put them through federal, state, and background checks and have all received training in accredited medical institutions. Our U.S. medical director, me, actually personally reviews the criteria of every one of our U.S. specialists. Here's one of our specialists, Dr. Yasin, an oculoplastic surgeon and ophthalmologist from Falls Church, Virginia. I'm going to just read one little piece here that's highlighted. Active Doctors Online has applied the best information technology and a vision toward the future to a fragmented system for a truly unique and valuable approach to getting a second medical opinion. What I believe Dr. Yasin is trying to say there is you're not going to find a second medical opinion process like this anywhere else. We have the highest level specialists, the most interactive system, and the quickest turnaround to provide you what you need when you need it. Here's an example of someone who's been there. This was a client who had a serious medical problem, and there was a question as to whether he should need surgery or not. Unfortunately, we did have to recommend that he did get surgery, but even though we didn't change the course of his treatment necessarily, knowing that our top doctors had gone through, looked at his case in an unbiased way, and recommended the surgical course of treatment, was able to put his mind to rest, knowing that this was actually the right treatment for him and not just for his doctors. As he says in his quote here, Active Doctors Online may have saved my life. And the peace of mind that he got from knowing that the surgery was actually necessary and not just going to make his doctor rich was priceless. Afterwards, he said he wasn't afraid to get the surgery because he knew it was what he really needed. And the final sentence, the small price I paid for the second opinion was definitely worth it. I'm going to pass it back to Kristen, who's going to go through how we can get you fully enrolled into our PHR and get available the second medical opinion process in the e-consult system.
So hopefully you've learned a little bit more about what it means and how you can benefit from a PHR. And it's very simple to get started. You can do this in a few simple steps during your enrollment, whether that's a designated enrollment period or really any time throughout the year. You simply register as a PHR member. If you're given a code by your organization, you use that code upon registration. The next step is to request or authorize records release. And so this is the medical records assistance that our presenter spoke about today. Through an authorization form, we can do that on your behalf, or you are able to request those records on your own if you so choose, if you prefer, and get that process started right away. And then next is just to simply complete your profile. And this is information such as emergency contacts, your name, birth date, the health provider information, your insurance information, any medications and dosages, some of those different areas that we looked at in the under the hood section. Fill out your family history, any significant illnesses or surgery. And by the time you have your profile completed, it'll just be that much further along when your medical records are then entered by us or by yourself. So it's a very easy process. We want to thank you for your time today. If you're interested in more information, feel free to contact us, or if there's a designated person in your organization, contact that person. You can always visit our website at activedoctorsonline.com, and we're also on Twitter, LinkedIn, Facebook, and our blog is ownmyphr.com. Thanks again.